Hello. So welcome all the delegates and today's faculty, Dr. Aninda, for the Med Talk show. Sorry, actually I am in an emergency. I had an emergency, so I had to talk from a hospital only ICU. So I welcome Dr. Aninda Siddhanta. Like she is a MD psychiatrist, fellowship in psychosexual medicine, assistant professor, Dr. SS Tintia Medical College, national president WICCI Mental Health and Psychosocial Wellness Council. And today we'll be discussing about the psychosexual health to the community and how it is affecting the families and overall it depends on, it affects the health of the people for the long term also. So Dr. Ananda, welcome for the show.
Thank you, sir.
And very common problem. Can you please enlighten like what are the issues into the community and will you introduce the exactly what are these, what does it mean and
Yes, so
yeah, please.
absolutely. First thing is like nobody talks about sex and nobody visits for a sexual health. First of all, there is a lot of stigma about mental health and then psychosexual. Nobody talks. Everybody feels ashamed if they have to visit a doctor. They can go to a faith healer or they will go to some shop, Ayurvedic person, but not enter the clinic of a doctor. And I fail to understand that the moment we get married or in our country and everywhere the world revolves around it, that everyone starts asking about the child, but you are not allowed to talk about sex. Then I wonder how the population is increasing and how people are comfortable. So that is, I believe that it is very important to break the myths and the normalize conversations around sex and sexual health. It is as important and as equally important as physical health and mental health. And sex is the integral part of the life as food, water, appetite, sleep. So we should not shrug
Yeah,
away this conversation, definitely.
yeah, thanks
So
for the information. Even like besides the married people and all, even the adolescents and all, there are so many problems because of lack of knowledge and the prevention steps not taken. This generation is totally different, and then there are so many diseases spread and health problems also issues happen because of the infections and all. With a not proper
yes,
education to the adolescents on these issues. So, would you
yeah,
like to say on that also?
yes, of course. Why proper education is not there? Because children are not open to their parents to talk about it. So I always say be friends with your children first and talk about everything and tell them, if because there is a stage when these are the curious minds, and those curious minds and the lead to masturbation, and that is very normal thing. That is not an no, not a abnormal problem. It's very normal to have in a young boy to have this curiosity and to touch the parts, and also so the curious minds and movement of hands, and but nobody understands and nobody talks to them and they are shrugged away. If we start teaching them about the sex education, and now it is highly important because digital media is there and children are being raised by the media, not by the parents or the teachers, and they can see anything, they can view anything. So better to talk what's going on in their mind, even about the orientation. They keep on hiding in the closet, and in the later on lot of problems come. So similar, the way we embrace the colors of the rainbow, similarly we should embrace the colors of human sexuality, lesbian, gay, and everyone is normal. It's just like someone likes the veg food, someone likes non-veg. It doesn't matter. Make abnormal.
Yeah, thank you for the nice, discussion. So, what are the most common psychosexual health concerns in the men and women in the society at present?
So since long, the most common problems in the male, the psychosexual health concerns in India and Nepal, it has been seen the in young age only they start having this Dhak syndrome. That is, they start worrying about some discharges coming out, and another myth they have that if they have masturbated during young age, now they are not able to perform or they develop the performance anxiety. So that is because of the myth only, and males come to me because of that. Then there is the uh, premature ejaculation, erectile dysfunction. In men, these are the main issues. In women, the issues are different. They are mostly related to the desire. First of all, women are not allowed to express the desire. If a woman expresses the desire even to the husband, at that time maybe they will not say anything, but at the time of fight, she will definitely be labeled, even in a marital relationship, which is a consensual sexual relationship, and that is still we label the women if they talk about sex. So the most common problem I have seen is they have the desire, but then they develop this hypoactive sexual desire disorder because it's not satisfied. Then they are not able to speak up. Like if they don't like a smell of alcohol and husband has come, but they can't speak up, and then it really leads to aversion to the sexual activity. So it is like communication is the key. We can improve the relationship and intimacy by talking about what's the wrong and what do you want. Another issue is the painful sex. Many women are scared because they are being like since child, teenage. It's like talks going on during the classrooms. Everyone talks about it's, oh my god, it's very painful, and that's why the sex education and awareness is the key. Then vaginismus, that is also the development because of the sexual uh, fear. And recently I also got to know about tocophobia, and that is I saw a movie, a very nice, which is going for the. It came to me for the screen that tocophobia, that is basically fear of giving the childbirth. It develops because girls keep on hearing about like it's very painful how it will happen, and now that's why there is a lot of uh, cesarean cases have increased. So that is the most common things are these libido, and just it's like lack of communication is the main problem. And women want the romantic Shah Rukh Khan and men want a porn movie star. So that mismatch is there. If communication is there, then definitely things will improve, and 99% of the sexual problems can be solved without medication, just by the communication.
So how does stress and anxiety affect the sexual health and intimacy?
So, absolutely, stress and anxiety, it affects every part of life as mind and body are married to each other. One suffers, other sympathizes. And sex is, anyways, it is antidote to stress. Absolutely. It releases dopamine, it releases good hormones. And when you are stressed out, how can you think about something good? How can you think about something pleasurable and you can't enjoy that? So the anxiety and the stress, whenever there is a friction in the relationship, or even between a mother-in-law and daughter-in-law, there is a fight, that will lead to the fight in a bedroom also. And people are not able to keep their boardroom fights, and those boardroom stress comes into the bedroom, and the relationship starts getting affected. So that is definitely there. And once person is not able to perform, might be it is due to stress, it might be due to the under the influence of alcohol, or maybe he's very tired, and then the man develops that anxiety that he will be judged, that he is not able to perform. That performance anxiety develops, and it becomes a vicious cycle. Rather than, it should be like communication should be the key, and relaxation and understanding is the key.
Even can diabetes, hypertension,
Yes,
the comorbid
definitely. So,
diseases, even like I have seen like as an allergist, I have a lot of couples and where the male used to say like if they have significant rhinitis. So during that intimacy, they get a lot of sneezing and blocked nose and all. So they are unable to do the properly, and then it affects the things. So what do you say on these things like this chronic disease
I have
and
seen that many men and men get diagnosed diabetes only after they complain of erectile dysfunction. Then they come with the complaint of erectile dysfunction. Since long they have the complaint, either erectile dysfunction or numbness. And when we take the history, tests have not been done, and you get the test done, cholesterol level, either cholesterol is high or the diabetes is there, and person becomes well when we reverse that. So it is the first in many men. That is the first sign diabetes is diagnosed, because nowadays lifestyle is like this. Everyone is having always on the go and junk food and not exercising. These non-communicable diseases have become very common, and that leads to everyone is neglecting their own health, and that leads to.
So, what do you feel like? Uh, what are the early signs of this dysfunction, and people should not ignore basically?
So earliest sign is in men, it is the reduced morning erection, which is a very normal thing. And when that morning erection starts getting reduced, then there is a worry that there might be some pathophysiology going on, or the ejaculatory control a person is not able to maintain. So that is there. Otherwise, the nightfall and the Bhaag syndrome and masturbation. Masturbation is like a once, anyways, Modi ji says Atmanirbhar Bharat. So it is a normal thing, and definitely that should be like it is. Someone does it twice a day, someone does it uh, thrice in a week, or someone does not do it, and 99% of the people do it, and 1% are lying. So that is normal, and it does not cause any weakness. So the variable sign is mainly the reduced erection in the morning, because that is a physiological erection, that morning erection which occurs. So then we should worry about it. Can't be because of stress, it can be because of some pathophysiology, or else ejaculatory problems are there. That is the thing. And in women, it is about persistent dryness and delayed orgasm. That is the, and if the pain is persistent, then we should worry about if there is some infection inside. Because the painful sex that occurs only once or twice, after that it is not common. So then there should be a worry that if there is some vaginal infection, that should be taken care of. So that is the thing. And sexuality is not a luxury. That is, of course, the most vital sign. We can say it's like a vital sign similar to the pulse and BP. Like a person comes with the complaint, we can get to know a lot of things about the family also and everything. So it's a most vital sign. And being erotic is not about the performance. It is about being present and being intimate together. So communication, and that is it.
So, very nice points you highlighted. Like pain and all, it should not be taken easily, and it should be investigated any
It
infections
can
or
be
something.
infection, it can be fibroid, and any problem can be there. Proper gynecological examination should be done. And if uh, we cannot diagnose a person without getting all, ruling out other things, just saying no, no, it is because of anxiety. We should rule out the hypercholesterolemia, then even urologic consultation. We get that done, of course, because physical health should not be ruled out, should not be ignored, and one should rule out that. Then we can say yes, everything is normal, so it is because of the anxiety and stress. Otherwise, some big problem might occur later on, and we have missed that.
So, why people
Teamwork.
hesitate to discuss about that? I mean, with the
So people
consultants.
hesitate to discuss about. Definitely, nobody talks about it. Even I talk about it. That is also, people say like she talks about sex. When I am a consultant, only I have done my fellowship, and that is my area of interest. Why will I not talk about it? And what's the harm when we talk about food, when we talk about water? It is, and this is the only thing which is uh, creating, that is a procreation. So people don't talk about periods also, which is provocative, and that is a creation of life. Even about sex, that is there. But everybody wants child, everybody is in a hurry to get a child, and but you can't talk. Then there is a problem that uh, when you are living with the in-laws, it is either it is a curse or a blessing. Like it's a blessing if after the childbirth they help you and they take care, but it's a curse because while in-laws are in this room nearby, uh, people hesitate to have sex, and they can't express themselves properly, and there is always a fear of judgment. So whether it's a blessing or a curse, that has to be seen. Yeah. So that's why it's very important to like, and everybody cannot afford a vacation to Switzerland or anywhere, and you can enjoy in your own home. You can create that environment, romantic music, and just relax and massage and all. Those things are important. It's not important where you are. It's important how your relationship is.
So basically, the understanding and communication between the
Yeah, that is
partners
of
is
course
very
the key
important.
because
And
sex is the glue and intimacy is the glue to keep our marriage alive.
okay.
Why say sexless marriages? There are in India there are many sexless marriages because it has been like women think that now my duty is over, children are born, and now life is only for children, and they neglect this part. Or it's like as if sex was only to give birth to the child, but it is not for that. It is for your own body. It's a normal thing which you have to. That has to be taught to the children, everybody, and this comprehensive sex education should start from the school time.
Can the hormonal imbalances affect the libido or the sexual well-being, and
Yeah,
how it does it? And yeah,
yeah, absolutely. Hormonal imbalance affects not only the libido and sexual well-being, but also the mood. And mood is also one thing which is very important to have sex or not to have sex. And in women, hormones and mental health is a very large, vast topic. Women hormones, mental health, because a woman goes through four stages. There is a menstruation, menarche, then motherhood, postpartum, menopause. So on all those stages, you see all different nine devis of the woman, because that mood swings are so high and low. At times she's very angry, at times she becomes very loving. But these are the hormones speaking, and that is one thing which causes the friction in relationships at times because during and another thing like whether to have sex during menstruation or not, that is also a problem. Then in India, there are a lot of religious days when women believe, no, this is a day when sex cannot happen. And like Tuesday, we cannot have sex. Navaratri, we cannot have sex. Why? Who told that? God only made us and God only made this creation. And who told like in Navaratri, you cannot have? So these fasting and these rituals and myths and all those affect a lot, and hormonal changes definitely. And libido is affected by hormone changes, even the dryness. The sometimes I have seen in many women that only giving the vitamin E and evening primrose oil, it increases the lubrication and it improves everything. We don't have to give any medications.
good.
And in men
That's a
also,
very
of
good
course,
point.
testosterone, but in men it's very rarely like I mostly believe that most of the clients are treated by talking. So very rarely it has been required to give the hormones.
And mostly, like most of the diseases, we always talk about the stress, mental health. So how also here it plays a role in psychosexual wellness, mental health specifically.
Of course, mental health is plays a role, not only psychosexual wellness, that is the most important thing in their life. Our mind is only running the body. And I don't know why everyone is ignoring the mind, and no one takes care of the mental health. No one talks about mental health, and mental health is not a luxury, it's a necessity. And until and unless we are going to be kind to our mind, things are not going to change. And we all are fighting a battle. So everyone is stressed out, everyone is wearing a mask. So you cannot predict that, of course, just because your husband was happy in the office and that there he was wearing a mask of being happy. And at home he can express his stress. It should not be a cause of the battle. So when you express properly, then the mental health, like take care of each other's mind, that is important. Because even women, they are working women, everyone. So there should be the equal responsibility, mutual trust. Equal responsibility can't be there as caregiving women can do. So definitely mutual trust, celebrating each other's wins, and respect is the most important thing. Love anyways fades away with time. And the mental wellness plays an important role, as once a person is anxious or stressed out, depressed, the first sign will be decreased libido. And then there is paranoia when it develops. Then of course the infidelity, fear of that, all those things come. Alcohol, it increases the libido, but it decreases the performance. But nobody understands that. You feel like a macho man, but you are not able to perform because under the influence of alcohol. And then the
So
another
you
myth is about the size. So those things, of course.
so basically the lifestyle changes. So what will you guide the people about, like what type of lifestyle changes they should have to have a good
So
psychosexual health
first thing
naturally,
is,
basically?
I will guide about, first start talking about it. Whether you are husband and wife, whether you are in living relationship, whether boyfriend, girlfriend, whoever, until you talk about it, that what do you like, whether you like to be kissed or not, whether you like the foreplay or not, because everybody's demands are different. Someone likes to be kissed near the neck, or someone likes to be kissed on the back. Someone is allergic to something. So talk about it, or be have open communication and be comfortable. That is one space, your safest space, that should be. And you can express your emotions also there, be vulnerable. Then that is the first most important thing. It doesn't matter wherever you are. And another thing, yeah, of course, the relationship, your fight with the mother-in-law should not come in the bedroom. Your stress from the office should not come, that file should not come in the bedroom. That bedroom should be a sacred space for the sexual thing, because otherwise you, that fight, stress, you cannot have that libido. And then self-care, luxury. Self-care is not a luxury, it is not selfishness, it is, sometimes you need to enjoy that. You have to indulge in the candles, then you can indulge in, why people say that spark is not alive, why spark goes away. We can stop that spark going away only. Keep treating your wife as your girlfriend, and keep being a girlfriend to your husband. You used to wear short dresses when you were a girlfriend to your husband. Then why you started now? You, whenever he comes home, why are you in the messy dress and night dress and all? How will he feel excited? And you are always tired, and the moment he enters, you start complaining. How will things happen? And of course, men, they used to come with the rose, come with the, be so romantic, and suddenly everything stops. So keep being the boyfriend to your husband, and keep boyfriend to your wife, and keep being the girlfriend to your wife. So that is the key, that love and trust, all that should not go, and that is a normal thing, and it should not be made fun of. And till eternity, till the last breath, it is a part of the life. It is not, there is no age in bar for sex, no time bar, no nothing. And it is like love can happen anywhere, so it can also happen anywhere. So until you are relaxed, you think that this is important, then only things will change. If you start neglecting, no, no, in marriage, the only thing is, okay, if mother-in-law has taken the medicine, if children have gone home, or breakfast has been done or not, my work is over. Or husband is just got the salary home and things are paid the rent, that is over. That is not, that is like two roommates living together. So sex is the most
Thank,
important part and the glue to keep your marriage alive. So stress, yoga, everything you can do, but the communication is the key. I will say first step is the communication, to break the silence, and then only things will change.
thanks for the golden tips. I mean, really, it will be practical and very useful to the community. And even the doctors can guide to the patients about these tips. And what do you feel like? People always talk as the age advances, this problem happen. But is it common in the younger people also, younger couples?
Yes, it is nowadays. Anyways, marriage has become a failed institution. So it is common in younger couples also, as there are a lot of fights, and then how the physical relation can be there. And definitely the multiple sexual partners, these problems are there, infidelity. These are the issues younger couples. And so there is a lot of difference between the earlier generation and younger generation. That total difference is there while decoding the relationship and love now and earlier. Now it's like swipe right, swipe left, come next. Earlier it was not like that. So this is the uh, it was earlier it was a sacred and trust bonding was there. Nowadays relationships have become transactional, which has to be changed, and kindness and that love should come back.
When the person, like it may be male or female, they should seek a proper professional advice, and the team, basically the team should be involved into this. Even as you
So
rightly said, the
we,
mental health.
of
Yeah.
course, like even mental health treatment is a teamwork. First of all, like my like role model, like mainly the inspiration for like actually my dad is also psychiatrist. I am from a family of psychiatrists. I took psychiatry, but my interest developed when I first heard the talk of Dr. Nimesh Desai from Ibhas. So he always says that psychiatry should be DM psychiatry after MD medicine. Because once you rule out all the illnesses, then only you can say, yes, it is because of stress. Until the body is not fine, how can you say it is because of tension? So, in that, he is very right that, of course, we should not neglect that. Similarly, in sexual thing also. So physical, of course, mental health treatment. It's the treatment is the teamwork. I am equally important. The mental health nursing staff, mental health social worker, and the psychologist and psychiatrist. Everybody has different role. Nobody is above or below. And similarly, in a sexual medicine, there the social worker because they tell about the relationships and how the social situation at home. Maybe they don't have a room only to have sex, or maybe they don't have a privacy only, they are not allowed only to have that. And then there is another psychologist because sometimes the attachment issues are there, so doctors don't have that much time to properly check about what are the attachment issue, what were the adverse childhood experiences, how a child is raised, that develops a lot of relationship issues, like whether the person will have trust issues or not, how safe a child was during the childhood. If a person has seen the marital conflicts in a childhood, definitely there will be problems and they will have trust issues. Then there is and then the surgical part. Of course, we cannot rule out, we cannot say it's erectile dysfunction without proper doing the physical examination. And psychiatrists hardly do the physical examination, and definitely we have a team, and urologist also is important. So it's all, instead of getting the tests done, human touch is important, examination is important. Instead of getting all the tests and all, tests come last. People keep on getting the penile doppler and all, but until you talk about everything and until you do the physical examination, there is no point in getting all that expensive
Thanks for
investigation.
sharing
So
all
it's
the
a
details.
teamwork,
And
of course. And gynec is
yeah,
important. Skin specialist is an important part of a sexual disorders.
really, I mean, very nicely you explained all the things. So, will you like to say the practical tips, like to the people, like how they should manage it, and in early identification, timely visit to the consultants or the proper
So
professionals, and
basically,
yeah,
yeah,
yeah.
you were saying
So
something.
that way they should have a, I mean, their usual day-to-day life. They should be really, I mean, take care of that. Please.
Yeah, yeah, of course, that sexuality, it is not about your performance, it is about your satisfaction and it is the expression of love. So just remember this, that this is very important part of life. And the way mental health is important, this also should be the in the center of public health. There are all, I have worked in a dispensary and every kind of medicine is available in a dispensary PHC. It's just that we don't know how to use it. People come with the problems, but medicines are thrown away because we don't identify. So those, everything should be, our radar should be open. First of all, we should read about the uh, uh, even we didn't read about like because it was like a optional choice whether two questions come from skin or psychiatry. So people ignore that. But in a PHC, every medicine is available. In Rajasthan, I can guarantee like most expensive medicines are also available. But Nobody uses that because you don't know what's the problem is. You don't ask, how are you feeling? Or are you happy? A person will come with the problem and we just diagnose and give the medicine. But many clients, when they come to me with a long backache, long physical problems, and I start talking to them in the second or third sitting, definitely the problem comes out either to be marital issue or the sexual problem that they have not had sex since long, and why there is a problem of a smell of alcohol or some in-laws issue, some like then body image issues are a lot there. There is a lot of comparison, size zero, and all those things. So it's like you give time to the client. First of all, they are not patients; they are clients, of course, coming to you, and i- while talking to them, definitely multiple somatoform people who keep on visiting the doctors with multiple somatic complaints. Definitely, either problem is there, either there is some stressor in relationship, or like we call it mother-in-law and sister-in-law syndrome. That when sister-in-law is about to come, a person becomes ill. So that is Mill syndrome. That daughter-in-law becomes ill when mother-in-law has to come and stay. Otherwise, she's fine. Absolutely, there is no issue. So that is all those dynamics have to be discussed. And similarly, in LGBT, I have seen many clients coming to me with anxiety, depression, and physical complaints. They don't tell in the initial 2 3 sessions, but later on, when you ask with patients, you will get to know, oh, that is the identity. So you have to be first open minded and non judgmental. And I think I am the first, I will be the only female that in my cabin mostly the queue is for the sexual problems only instead of psychiatric. And for LGBT, I guess Rajasthan, Punjab, everywhere people come to me only like here. And but when they come and ask me if it can be changed, so I have just one answer. Then you have a lot of doctors. You have come to the wrong doctor.
Thanks, Dr.
So one
Alinda,
should be
for
open
sharing.
minded, and I got the open mind after doing my psychosexual medicine fellowship with Dr. TSS Rao sir, and after going through my own life experience. I can't hear. Sir, you are on mute, I think.
So basically, thank you, Dr. Alinda, for really, sharing your views and your experience into the. It will be
So
really
actually,
useful to the community. Thanks to
educational thing,
MedTalks
but
for
in normal
organizing such a
language.
very nice webinar. Yeah, it's very nice. It's a very important issue to the community. Thank you. Thanks a lot.
Thanks a lot, sir. It's over.